Dr. Walter Lemmo is a naturopathic physician who believes in combining the best of complementary and alternative medical approaches along with oncology medicine when he cares for people with cancer. April is Cancer Awareness Month, the perfect time to welcome Dr. Walter Lemmo back to Studio 4 to tell us more. Nice to see you again.
It's a pleasure.
And I forgot to add you have a degree in biotechnology.
Right.
How many kinds of cancers are there? Do we have any idea?
There are many types of cancers. Just like how people are unique, cancers are unique. There's hormone-dependent cancers, there's non-hormone-dependent cancers. You name it, the class can be an endless category. There's cancers that are, say, non-tumor-based in the sense like they're blood-based cancers, like leukemias, lymphomas, and then you got the solid mass ones. There's a whole variety of types that are out there.
Is there a type that's tougher to beat than another type?
Well, I think in general there are, like, say, statistics with certain types of cancers, like, say, a Hodgkin's lymphoma tends to be really treatable, like testicular cancer. And then you get, say, like other types of cancers, like melanomas, malignant melanomas, which is another category. And
is that easier or tougher?
Tougher in terms of statistically, you know. Obviously, when a cancer is a lot more common, you see a lot more research being done in that department. Like, say, with breast cancer, there's hormone-positive breast cancer. There's a lot of research going into helping those categories out. But say there's also another category of hormone-negative cancers where they're kind of a smaller group, and there's not a lot of statistics and groups to help those population groups out.
Any idea what's going on in the human body when a cancer decides to grow? And I'm assuming it's an ordinary cell having just a good time, and one day it decides to do something else.
Well, you know, a lot of people don't realize that the process of cancer, it doesn't happen overnight. You know, it's like when you even look at the standard textbooks, it could take between 10 and 20 years for actually cancer to develop and to actually be detected. So the question is, what are these variables that are involved? So we know there's some factor at a genetic level, and then for whatever reason along the way, things kind of trigger it, and away you go with it. And so it's not so a lot of people have a misconception about that process too.
There is a theory, and you can blow holes in it if you'd like, but there is a theory that everybody has some in them, and occasionally your immune system just takes care of it.
Well, that's actually
all by itself. You don't know. Immune system working, goes away, never knew you had it.
Well, there is that idea as well. Like, we do make cancer cells every single day, and for whatever reason...
We do?
Yeah, we make cancer cells every single day, but for whatever happens, like there's the people that where they start getting cancers and detected, something's going on in the machinery. We do know that when you look at general cancer incidences, it's kind of a process of aging too, maybe the body getting a bit more tired. So when you look at, say, standard statistics, we're looking at aging, when you're hitting about 50, 60, 70, 80, it just starts to go up like this. And so there's mechanisms involved there that maybe the body getting tired or overloaded or whatever have you.
A naturopathic approach to cancer is different from a regular approach. How?
Well, I think what it is in naturopathic medicine is that we acknowledge both worlds. We acknowledge the standard system, but we also acknowledge that the whole person being an individual in front of us. You know, we're encompassed by our environment that we live in, the relationships people have, the physical activity that people do, their diet intake, there may be their potential risk for exposures. You know, there's a whole encompassing thing. And so naturopathic medicine is one term. The other term is becoming integrative medicine. And so in some instances, cancer could be as unique as the individual. And so that's why there necessarily isn't a one standard approach for helping somebody. But at the same time, what you're noticing in naturopathic philosophies is that you're seeing a fruition of these fundamental approaches actually impacting diseases. So in essence, we know that diet and lifestyle can actually help you prevent cancers, but we're also realizing that these core fundamental things can actually impact people with cancer and actually minimize recurrence and make them live longer. Core fundamentals. And so, like say, we're realizing more and more that being physically active is an important thing for prevention, but also with people having specific types, like say breast cancer is a popular one where you're seeing, you know, people that are more active can live like 60% longer. We know, let's say with colon cancer, for example, that say those are diagnosed with more advanced diseases if they do more of a vegetarian diets, more chicken, fish, less red meat, the recurrence risk could be reduced. Core things. And so in some instances, one of my good patients, Monica, she probably terms it, you know, nature's chemotherapy. You know, that's probably a standard way to think about it. And what's interesting that I find is that it's kind of like when you look at heart disease, back 30 years ago, like I worked with 4 medical doctors, and the CEO there is Hal Gunn. When he was in medical school, he was kind of taught that no, there was no connection really with diet and exercise and heart disease, you know, 30 years ago. And now we're realizing, well, that's not true. And the similar kinds of ideas emerging in cancer care. We're like, you know something, before, what, you exercising can kind of make your cancer, you can live longer with your disease. Now it's actually coming into fruition. So we're seeing these core fundamental things having tremendous impacts in people's survival, recurrence, and more.
Treatment, many options. Radiation can cure, chemo can cure, combination can cure.
You bet.
Surgery can help and sometimes cure. How do you know who to trust, what to do? You're a person living with a diagnosis. The oncologists come together. You're there. The doctor's there. Maybe the GP's there. The team
You bet.
is in the room.
Well, I think you bring up an interesting point, is that when you get a diagnosis of cancer, emotions are cruising through everyone's brains and families. And so the big thing that you have to do is who's on your team. You know, like who are the people on your team? You want the people that are more objective, but also hopeful as well with whatever type of diagnosis you have. Like I've seen people where, say, maybe the oncology team wasn't too hopeful for a certain diagnosis. The people are feeling down. All of a sudden, you restructure their team and they're kicking butt. You know, so when you're saying who do you trust, you have to trust your professional, trust your gut, right, and also, you know, trust what resonates with you as well. That's a part of it too.
Oh, the trust factor is big. And how about the thoughts? How about the ant brain or the monkey brain? Right. If you've ever had a cancer and beat it, you know every time you get an elbow ache, you think, oh, that's it. Yeah. A month to live. I don't know how you help people get those thoughts, because the follow-up is you know, very intense to all cancer patients, which is good. Yeah. But every time the doctor calls you and says, would you come in and have an MRI? It's time for your MRI, or it's time for your scope, or it's time for your this or your that. Right. Anybody, I think almost anybody, unless they're just not present, thinks, oh no, what if they see something? What if they find something? What if it's done for me? Right. How do you teach people, your patients, to say, okay, let's think at the positive end of the scale. It's gone, I'm fine. Right.
You know, you bring up an interesting question, and I'll be honest, it's a difficult one for a lot of patients in general when you get a diagnosis, and that's where also expertise can come to the equation. It's like, say for myself, for example, I know about standard oncology medicine and also the natural things. So a lot of the times when people are coming in with that elbow ache, they're kind of coming in going, no, it's not what you think it is. You know, I know we all think the C word, but there's some, it's that cold that you got. It's not like, you know, cancer is spread to your lung. And that's where like core fundamental approaches is really, really important about watching with like stress reduction techniques, being more physically active, in essence empowering yourself to kind of, you know, to do the best you can and move forward.
But it's everything
it's not easy. You know, like in the back of the brain it's there, but we're trying to hopefully make the volume not so loud. Yeah.
It's true, and you know, I mean, anyone who's had an MRI for any reason, I know when I've had mine, you come out and you look at the technicians to see if they're looking back at you or if they're whispering. And I don't know when you have an MRI if they even know anything, but you're still thinking, oh, are they acting differently than when I went into this machine?